had been unable to diagnose. I couldn't believe it. They have a digital motion x-ray machine that allows them to view your x-rays live in motion, and were able to see what was happening in my neck that was not visible on a standard still x-ray. Hey everyone, Dr. Todd from Gonstead Spine Wellness. I'm sitting here with trainer Tony and Primetime Paul, and on this video, we're actually going to do a review of a review. So we have lots of Google reviews and various social media feedback reviews from patients that have experienced amazing results in our facility, and they've shared their stories, which is so cool. So we appreciate all of you out there that are willing to share your stories, because these help other people who are desperate, who are looking for hope, maybe lost hope. And sometimes reading these stories or hearing about these gives them an idea that there's something out there that might be able to help them. This review comes from Frankie. She was kind enough to give us permission to share anything and everything about her case, even her x-rays, her imaging, in the hopes that this could potentially help someone else. So with that said, I'm going to start reading through her review, try to highlight some of the important things here. We'll have some visual footage in the background, maybe explaining and showing what this is and trying to give clarity so you as the viewer can understand what she went through, because some of the things she's going to refer to here, you're going to be thinking, what the heck is that? Or how is this different? I've been to a physical therapist and done exercise and been to a chiropractor before, so what makes this so special? We'll give some clarification along the way to really tell her story and make it educational. So with that said, she starts off, she says, I cannot say enough positive things about Gonstead Spine Wellness. I've had back pain as far back as I can remember, and a few years ago, I began developing severe neck pain as well. I've had numerous x-rays and MRIs to determine the cause, but without any answers. She then continues, my doctor, Leanna Mosier, started recommending Gonstead a couple years ago, but because I'd already tried physical therapy and chiropractic at other places, I assumed Gonstead would be no different, and the other places hadn't helped me. That maybe takes a little clarification. Paul is the first face that our patients see when they come back to the exercise department. What are a couple of components in how we do rehab and exercise that make this different?
Based on previous experiences that I've had with other chiropractic offices, I would say the one biggest thing that we like to implement when it comes to Gonstead Spine and Wellness is the multifaceted approach that we have when it comes to the different type of care that we offer. But the three things that we mainly look at for someone's health is segment, posture, and movement. Now, what is segment? So, Dr. Todd, if you want to go into that.
Like Paul said, these three different categories, traditionally, each one of those things that Paul mentioned, segment is a chiropractic thing that lots of chiropractors do, right? They're looking at the individual segments of the spine, sometimes the joints of the extremities, shoulder, elbow, wrist, hip, knee, ankle, foot, those things can misalign as well. That's the segmental approach, and we do things different in the Gonstead method. It's a very specific segmental approach. We use x-ray to help in the process of being precise. We adjust the joints of the spine in such a way where there's little to no rotation, so it's a very different chiropractic adjustment. And then Paul touched on posture. Posture is if you zoom out. So if you're looking at individual segments, you zoom out and you see how do they all come together and align and make up regions of the spine. And when you have a segmental problem, that can weaken regions of the spine, cause the posture to shift and distort. Those are called postural distortions. We have to identify those and then do specific treatment to fix them, like exercise and traction, right? Mm-hmm. And then the third thing is the point where you're assessing, you're measuring, identifying abnormal movement patterns, and then fixing the abnormal movement pattern. What is a movement pattern?
In daily life, there are specific movements that you're going to be doing. Depending on what movements you're going to be doing, are they functional or dysfunctional? Now, what does that mean? That basically means, are you loading through the joints and the musculature correctly, or are you moving it through a weird dysfunctional movement pattern that can create pain eventually? That all gets reinforced over time, and the whole goal for what we're trying to figure out here is when we find those dysfunctional movement patterns, is breaking that motor control reinforcement that you've had over years and years of doing that same thing and creating more functional movement patterns that we reinforce over time, so you don't have to have the same issue reoccurring every time.
So like fancy word, motor control basically means that you have something that your brain has patterned in there that says, this is how I'm gonna move from point A to point B, and I'm gonna do this over and over and over again. That's one of the things that needs to be identified and then broken and then rebuilt, is that pattern in the brain. And this is a thing that Paul is an absolute expert at doing. And not only is it something that he has a huge knowledge base at implementing with patients, but he follows the systems that we developed here to make it fun and engaging. Like, for example, we have a belt system of functional movement. So our patients start as a white belt, and then what happens from there?
First off, when they're starting off with a white belt, we have to show them a few different exercises that they would have to couple in with every other exercise that they're ever gonna have to learn, which is how to breathe properly, how to hinge through specific joints, and then how to use their core. Then from there, when we get to the yellow, blue, green, orange, and black belt, that's when we start to implement more advanced exercises that couple with that specific belt in order to push them towards that more functional movement pattern that we're trying to get them to. Because realistically, a lot of the movement patterns that we perform here are just trying to reinforce the movement patterns you do in daily life, because if you can make them easier in here, you're gonna make them easier out there.
Essentially, there's different ranks where we've gamified the process. There's belt levels, so as someone improves, they reach that next belt level. And ultimately, at the end of the day, like Paul's saying, we're trying to get someone functional so that they don't have to think about what they're doing. It's just so ingrained into their brain and into their body, and they have the capacity, they have the ability in joint range of motion, in health of muscular tissue, that they can get from point A to point B in the way that it was intended to happen, meaning with strength, stability, resilience, being able to do it over and over again, all the way up until their 80s and 90s. She continues and says, in addition to that, all the staff are extremely friendly and welcoming, and very quickly made me feel very comfortable. I'm painfully shy, so the first couple visits were a bit overwhelming just because there was so much to take in, but their staff are wonderful and over the top friendly. We do our best to accommodate and to be friendly and to be over the top and to improve someone's mood and energy and be encouraging. She says, from the moment you walk in and you're greeted by the front desk, who's always smiling, knows everyone's name, then you go back to functional movement area and you're trained by Paul, who's super friendly, motivates you to do things you didn't even know you could do. Then you're adjusted, and then you go over to traction, which is the last step, where they carefully put you in the traction machines and then check on you multiple times to make sure you're doing okay. Another thing that amazed me is that Gonstead was able to diagnose my neck problem, a problem that other doctors' offices, x-rays and MRIs had been unable to diagnose. I couldn't believe it. They have a digital motion x-ray machine that allows them to view your x-rays live in motion, and were able to see what was happening in my neck that was not visible on a standard still x-ray. That's another key thing. We have digital motion x-ray. It captures 30 frames per second, so it's a video x-ray essentially, where you can move through different ranges of motion. We could challenge the integrity of the joints, like how are they moving? If your problem happens when you move, you probably want to capture it when you're moving. And static standing still x-rays, and even MRIs for that matter, were never intended to find the things that a digital motion x-ray or a stress x-ray study are meant to discover. Here is Frankie's digital motion x-ray. So she's moving, she's bending her head forward and backwards, and we watch a couple segments slip and shift too far backwards. So right in here, 2, 3, 4. So C3, C4 are shifting backwards on the one beneath. That's called a spinal instability. That's one of the issues we're seeing here. This view, it's an open mouth, lateral bending, upper cervical. Essentially, we're looking to see if the first bone in the neck is sliding over the second bone, and there is some instability in the upper neck. It's not the worst one that I've ever seen, but it's enough that it flagged certain protocols for us to take her through. This is the first stage of the iron neck protocol for cervical instability issues, just like Frankie had. Something you'll notice is Trainer Tony is facing in a variety of directions. This is just a static hold, and he's challenging the ability for the muscles to hold him in a neutral position. We progress this to stage 2 and 3 that makes it a little more complex, and there's some other variables that make this more challenging. She continues, I've been told by previous doctors, not my primary doctor, who recommended Gonstead, and is also amazing, that my condition is degenerative and that there was essentially nothing that I could do about it, and that I should expect to just be in worse pain as time went on. This, of course, led to even more pain due to weight gain and just a sedentary lifestyle that made my body hurt more. Trainer Tony, talk about that a little bit with when people can't exercise and they get in that vicious cycle.
This is something I saw a lot when I was working here as an exercise therapist, and it's really heartbreaking because this is somebody who wants to move. move and somebody who wants to exercise. And so we're lucky in that we can help them, because what they'll try to do is do it on their own, go back to the gym, get injured, take some time off, go back again, get injured again, until they finally just give up. What we can do, and what Paul does as an exercise therapist, is we come in and we take a look at how they're moving and try to pinpoint any dysfunctions and address those so we can develop healthy movement patterns.
And that is something I hear quite often from a lot of our patients and working with Paul, is they say, you know, I was working with a personal trainer and I hurt myself, or I don't feel like they're watching me as carefully, or I don't feel like they know what to look for. And I feel like Paul is watching me and identifying things that maybe I'm doing wrong that I don't know, and he's catching it and correcting it. And like just last week, I had patients that exercise on a regular basis, and they're telling me, you know, Paul pointed out all these little things that I was doing wrong with my squat that I had no idea on. And just those little cues has totally changed how I squat or how I do a deadlift or whatever. So there is a thing called dysfunctional fitness, where people work out and they go to the gym and they might look aesthetically in shape, but then when we're actually looking at them with laser focus on how they move, we're identifying these things that they don't see. So it's not like our patients who come in here have no exercise experience whatsoever. On the contrary, we have some patients that start care that are athletes that exercise quite a bit, and they're the ones that might have a lot of things that are really functional, and they might have 2 or 3 movement patterns that are just awful that they really have no idea about. She continues on, all I can say is that I wish that I had listened to my doctor years ago, and that I can't recommend Gonstead highly enough to anyone who's suffering and in pain. My quality of life has dramatically improved, and it's all thanks to Gonstead Spine Wellness. So that's awesome. Really though, Frankie, it's because you followed what we taught you to do. You were a good student. You were a participant in your process. You did your home care. You showed up for your appointments, and you didn't give up. That's why you got great results, is that we have an awesome formula to help you, but you have to be willing to take the steps necessary to make the transformation and make the change. Okay, so there you have it. That is a review of an awesome review from Frankie. If you want to get checked out for yourself or a friend, family member, loved one, feel free to reach out to us on the information provided, and we can do a consultation. We can see if it seems like you will be a candidate for care, and if so, we'll do a full workup with you, just like we did with Frankie, whatever's appropriate to your situation. Make sure you like, subscribe, comment, whatever platform you're seeing this on. We appreciate you joining us for this, and when it comes to the health of you and your family, results matter most. Video presentation by Meridian Gonstead Spine and Wellness of Meridian, Idaho. Our practice is dedicated to people suffering from neck pain, low back pain, tension headaches, migraine headaches, herniated discs, and leg pain such as sciatic. We have treatment protocols for musculoskeletal aches and pains, joint pain and dysfunction, and whiplash injury. Gonstead Spine Wellness offers a distinctive chiropractic experience. It is the only office in Idaho with digital motion X-ray technology. And this advanced imaging tool, combined with the Gonstead spinal analysis and necessary radiographs, enables precise identification of spinal issues. We provide safe and effective Gonstead adjustments, corrective care through chiropractic biophysics to enhance and sustain proper posture, and a 12-week transformation program. This program includes access to a comprehensive video exercise library for ongoing home support, ensuring long-term health and wellness. Call us at 208-888-6077, where results matter most.